So we're now live on Facebook. If you just got a notification and are joining us on Facebook, a warm welcome. This is truly an exceptional event. We're going to be talking about electronic immunization registries with the Pan American Health Organization and colleagues from global partners. Very much looking forward to this session. As you can see, we'll be starting in just over 3 minutes. See you soon. We're starting in less than 2 minutes for this special event on electronic immunization registries with a team from the Pan American Health Organization that authored the guideline on the topic, as well as colleagues from other organizations. We'll see you in over a minute if you've just joined us on Facebook. Warm welcome to you. We'll be looking at your comments and sharing them with the panel as well. See you soon. Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. Today, an exceptional event ahead of the course on electronic immunization registries from planning to implementation. If you are just finding out about the course, I hope you're going to enjoy the event. Unfortunately, applications were accepted only until the 30th of August. And in fact, the point of this special event is to share the information and engage in dialogue around electronic immunization registries today with everyone who has an interest in the topic, whether or not you applied and whether or not you will be accepted into the course. So together with me here is an exceptional panel of distinguished guests, starting with the PAHO team. And I'm very pleased to introduce Lauren Vulenovic from PAHO, I believe, who is going to be facilitating this session. So I'm now going to hand it over to Lauren, and we'll be sharing with, yes, here. Lauren, are you there? How are you doing? I know it's early morning for you. I believe you're based in Washington, D.C. Would you like to take it from here and introduce the panel?
Hi, sure. Thank you so much, Retta, and hello to everyone. It is indeed morning here in Washington, D.C. It's a gray, rainy morning, but I hope that all of you from all over the world, it's so great to be connected. I hope you're all doing well today. As Retta mentioned, we've got a great panel lined up for you today. Just wanted to do a quick couple of notes here. First of all, we wanted to ask if everyone could please keep their mics off for now while the presentations and the panelists are going on. We're going to have a quick introductory PowerPoint from Dr. Marta Velandia, who is a regional advisor for immunization at PAHO, which is the Pan American Health Organization. We're the regional office for the Americas for the WHO. And then we're going to move into our panel discussion. We have a few questions already lined up for our panelists, but we also invite questions from the audience. So if you have questions or comments that you'd like to share, please go ahead and put those either in the Q&A box on Zoom, or as Retta mentioned, we will be monitoring on Facebook as well. So please feel free to enter those at any point, and then we will get to try to respond to as many of those after we have our first round of questions for the panelists.
And Lauren,
and this,
I just want to mention there's a few people who are greeting us on Facebook. So James Munguiko, I'd like to share his greeting to the panel, as well as Ense Ikpat, who says, hello everyone, Ense Bong Ikpat connecting from Nigeria. If you could tell us the city and country, Amel El Taher from Pakistan, and Rajat Garg from India. Back to you, Lauren.
Thank you, Retta, and thanks. Hi, everyone on Facebook too. It's so great that we can all be connected on various platforms. It's really exciting and really nice to all be connected. What we will do now is I am going to give the floor over to Dr. Marta Velandia, who, as I mentioned, is a regional advisor for immunization at PAHO, for her to do her presentation, and then we'll introduce the rest of the panelists and get our conversation going. So thanks very much. Go ahead, Marta.
Good morning, everyone. It's a great pleasure having you here. I'm very happy to see all the places all over the world. So more than happy to having you here. As Reda mentioned, we want to share this webinar with you regarding immunization registers, because we are starting this interesting course. This is the second cohort. The first one was in Spanish for the countries that speak Spanish here in the region of the Americas, but now this is in English, and we are looking forward for more webinar on this and courses regarding this interesting topic. So I want to share with you the experience of the region of the Americas regarding the electronic immunization registers. So I would like to share my screen, right, Reda?
No, so I'm actually sharing the slides right now. You should be able to see them
Yes, but I don't know how to go to the next slide. Okay,
just ask.
So I'll say
yes,
thank you very much. Yeah. Okay, thank you very much. Okay, so this is the outline of my presentation. So I will start with some background regarding the electronic immunization register. Then we are covering a topic regarding data quality and use. That's one of the main important issues with the electronic immunization registers. And then, as I mentioned, I want to share with you what's the level of implementation of the electronic immunization registers in America, some of the best practices, strengths and challenges that we have here in the region. And then we will have our very interesting discussion with the panelists. Next one, please. So where are the electronic immunization registers? So one of the most important things for us is that the electronic immunization register should be a part of the e-health strategy in a country. It's important that the electronic immunization register, that it's that is a system that registers every immunization of each child, monitoring vaccine, dose, geographical area, age, and provider, should be immersed in the middle of a health strategy. It should not, it has been there. It has been engaged in the e-health strategy in the country, and of course, as part of the health information system. So the electronic immunization register is in the center, but it should have interact with other systems that the country has. So, but it's immersed in this entire strategy of e-health. It's not a standalone. No, it should be part of the system. Next one, please. So this is the data process for for data quality and use. I think that this data quality and use should be part of an entire process. So at the beginning, you realize that you need data. So you need data. The first thing is you have to identify why you need this data. It's very difficult to try to get each data. So not just for you that have to analyze it, but also for the people in the field who has to collect it. So if you need a data, you have to identify the reason why you need this data. It's not because I am asking this, I will ask for other things. No, you have to have focus on the data that you need and to specify why I need this data. So this is the first step. So, and then you identify the way for collect this data. So you identify the best way to analyze this, to collect this information. And then you can see if the data that you need and you want to collect is available. You know, because if you are not able to identify where you can find this data, it's very difficult to try to analyze it. So this is the fourth thing, the data availability. Then when you have all these, you have the data analysis and interpretation. And this is an important thing in all levels. I was the EPI manager in Colombia, one of the Latin American countries. And it's important that we, as EPI manager, we are not just passing information from one side to the other side. So if you are collecting this data from the field for every child, you have to be sure that you have to analyze this information. The data talk to you, and then you can see and you can identify in this data what is happening. So this aspect of data analytics and interpretation, it's very, very important, because you realize when you have the data what is happening in your community or in your department or your entire country. But this is a very important part. It's not just to pass information because the other level require me to send the information. No, you need to analyze this information. And then, because you have already done the analysis, you have to use this information. So the data and the information is not for put it on your desk. It's for you to take decision based on those data. So this is the last and the beginning of the process. You know, you always are doing the same thing. And of course, as you can see here, you have data quality. So this is an important part in all the process. The other, the basis, the foundation of this cycle is based on tools, human resources, and processes. So of course we need to systematize all of these three different things to be sure that we have all the foundation to start with this cycle. Next, please. Okay, how is the experience in the Americas region? We are very proud to say that probably the oldest electronic immunization register is in our region. It was in Uruguay. This small country here. I don't know, Reda, if you can show it. But is this here towards Brazil and Argentina. No, down, 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 down. The blue one, the other one, the first, that one. No, this is Bolivia. Okay, yes, the small one.
The green one.
Okay, so this is the oldest electronic immunization register in the world. They started developing this electronic immunization register, and now we have all these electronic registers in the region. In green, you can see the fully implemented. So they are implemented in the 100% of the country. The other one is partially implemented. They are working, developing in some areas, or they are in the process to finally implement it in the whole country. And in stages of planning or pilot, we have those countries in blue that you can see here. Also, we at the regional level, with the help of many countries, many people, many of our partners, PATH, Gates, Gavi, CDC, we developed this important guide that will be the guide in our course, the Electronic Immunization Register Guide. So this is a very interesting product that it's available for you on our website. We can share with you the link to identify the way on how to implement an electronic immunization register. The next one, please. Okay, as I mentioned, we have been learning a lot of experience, and it's important to highlight that those experiences are from the countries. So as I mentioned, countries started developing electronic immunization register, and we, as regional office of the World Health Organization, we learned from them many things. And our main role is to try to share this experience between countries for them to learn one from the other. And of course, we are learning for them too. So some of the best practices that countries have highlighted are that in an electronic immunization register, you have to record the inclusion of all persons in the API target. And this is a very important issue. You have to be sure that in your electronic immunization register, you have the entire target population. And you have to look for all of them to be included in your system. Otherwise, if you are just counted the people that you have in your register, probably you have 100% of coverage because you are counting the coverage over the people that are in your register. But you have to triangulate this denominator and be sure if the people in the denominator is the entire population. Otherwise, you cannot see other people that are not in the register but are there. So it's very important, the inclusion of all persons in the API target. Otherwise, you have to identify how to get them in the system. The other important issue for an electronic immunization register is that you should have a unique identifier. This is very important. Otherwise, you can merge people, confuse children. So this is a very important issue. These two things, for when you are recording the demographics, are very, very important, and countries have highlighted them to be sure that when you are starting an electronic immunization register, you have in mind these two. The other thing regarding the vaccination, the event, when you have to record the vaccination event, you have to have all the information on the vaccine that you are administrating at this moment. This is important that you have to record the producer, the number of the batch, who was the person who gave you the vaccine, everyone. And this is very important because you have the traceability of this product. So this is a very important issue. For example, if you have an AFI, so you have to have all this information in your register to be sure that you can follow these kind of events. Regarding reports and individual follow-up, this is one of the most important things regarding electronic immunization register, because you have the ability to have every child and follow the child and be sure that this child have all their vaccines in all the moments that they have. So this is a very important product of the registers. So you can identify, you can follow each child, but also you have the ability to put all these things together and to analyze all the indicators of the program. And more than better, if you have those indicators, for example, if you want to identify by place of residence of the children, not by place where they were vaccinated. So this is very important issue. So you can analyze all this information, and depending on your electronic immunization register, you can include maps and very nice reports regarding how the performance of the immunization indicator. So this is a very important practice in the electronic immunization register. And of course, regarding the system, first of all, the data entry must be closer to the act of vaccination. We know that it's difficult that every health facility has their own computer, but if it's not the case, you have to be sure that those information should go to a place where they enter the information to the system, but very close and very soon, try to do it very, very soon. Its other aspect is the flexibility, the adaptability, and as I mentioned previously, the way that you can connect this system with other systems. And very important, last but not least, the importance of the safety and privacy protection and ethics regarding the electronic immunization register. Can we pass to the next, please? But we identify challenges too. It has been a very hard way. Very proud to cross all this path, but we have some challenges. For example, the communication and visualization should be exploited. So as I mentioned, we had information for every child, but you have information for all of them. So now in your hands, you have a gold mine. So you have to analyze all this data. It's not just for register and again, send the information to the next level. This is the main issue. You are not passing information. You have to try to analyze this information. And now with electronic immunization register that you have a lot of information, you have to take advantage of this quantity of information and try to analyze and try to, of course, take decision based on this. The other is the data quality. It is the same thing as in the paper. So if you don't have good quality in the paper, you have to be sure that you have better quality in your system. As I mentioned previously, all the things regarding security, confidentiality, and ethics of the information with the electronic immunization register. And implementation when you don't have access to internet. So you have to give the municipalities or the places that don't have internet other thing that help them to introduce the data. Probably offline system could help them to analyze. And some of the strength is I like this one because you can give all the person who are attached to the register all the information that they need. So, for example, the parents, they are able to enter to the system and see the card, the children, their child card regarding the immunization. So other strengths, for example, is you can provide timely information all the time. You have all the information. And this aspect regarding cost and effort. I think that at the beginning, the system, implementing a system, probably it should be cost. But at the end, when you have all this information and when the system will help you to increase your coverage, probably the balance is good for the system. And other strength, as I mentioned, is it's a collaborative work with partners and database. I think this is a very important issue because we in the API, we have to go to other people to present them what is the electronic immunization register and why they should be involved with the electronic immunization register. So you in the Ministry of Health, you have to talk with the people from systems, you have to talk with the people in planning, you have to talk with many people. It's not just a single effort for the API. It's a collective effort for everyone to go ahead with the electronic immunization register. Next one, please. So probably this is the summary of the things that I have talked until here. So first of all, PAHO always work with countries. They are the leads, and we are trying to help them and to share all this experience among countries. The other aspect is peer-to-peer learning. As I mentioned, it's the way that countries themselves help themselves to develop these interesting tools. The other thing is country ownership. And because this is a collective effort, it's not that the API, but the system and planning and everyone. So it's a country ownership of their system. The other important thing is the data use. So you have all this data in this repository of information. So you should analyze it and take decision based on this analyzing. And the last but not the least is monitoring and evaluation of data quality. If the data doesn't have data quality, you can you can believe in your data. Next. Well, as I mentioned, this was the wrap up of my presentation. So thank you very much. And we will open for question and hearing from our panelists now. So I give the floor to Lauren, who will present them. Thank you very much.
Thank you, Martha, for that great presentation. Let's go ahead. Let's see, Retta, the next slide on that presentation should be an introduction to our panelists. I'll go ahead and start introducing them. But yeah, that should be the next slide following the presentation Martha just did. So we have joining us today a great panel. We have Dr. Karen Broom, who's the PAHO sub-regional advisor in the Caribbean. She's also the former EPI manager from Barbados, and she is joining us from Barbados right now. We also have joining us from Zambia, Fred Njovu and John Richard, who are both technical advisors for PATH Africa. Joining us from Geneva, we've got Dr. Carolina Danavaro and Jan Gravendonk. They're both technical advisors for at WHO for immunization, vaccines, and biologicals. And then joining us from Vietnam, we have Mrs. Na Nguyen, who is the PATH Vietnam country director and also Ideal Vietnam program manager. So thank you all again so much for joining us for this session and for lending your expertise. How we have this structured is we have, and sorry, Red, if you can go back following that slide, there is one more slide there and it's got our questions for the panelists. There it is, thank you so much. So we've got one question that we would like everyone to answer, which is, has the Electronic Immunization Registry really been helpful to the program? And how has the registry changed the immunization program in your country or in your city? And then we also have specific questions that we would like to have you answer. So we'll start, maybe if we could start with Carolina and Jan. And we want to remind our panelists, because we want to have times to take a few questions at the end of the session. If you could keep your answers to about 5 minutes or so, that would be really, really helpful to keep the conversation moving. So starting with Carolina and Jan, we would like to know, what is the main motivation to promote the implementation of electronic immunization registries at the regional or global level? And then if you also want to talk about how EIR have been helpful to the program and how it's changed. So go ahead, Carolina or Jan, over to you.
So maybe I can start, and Carolina, if you want to add to that. I think, just to clarify, I don't think we necessarily promote registries or the implementation of registries in all countries. I think we have like a careful approach to that, and I think I would actually answer that question with 3 other questions. And I think what you should ask yourself before you go on with the implementation or the idea even to start this work is, first of all, is a registry like this in line with your objectives and your context and your program? What I want to say with that is, we all know, of course, that the registry, it looks very attractive. It does exactly what API managers can understand a system needs to do, because it follows each child and then makes sure it can be completely vaccinated. But to be honest, if you have a system where you have a lot of difficulties, even reaching many districts, or with supply chain, or with financing or human resources, maybe the registry is not your first priority or your first objective. Also, like, even though, well, Marta said that the registry should include all children, whether vaccinated and unvaccinated. Now, if you have a lot of unvaccinated, or what we call zero-dose children these days in your country, then the registry might not be the best solution. So this is something to think about before you even start it. And I think the next question, I said I had 3 questions. The next question is, would you be ready for a registry like this? So a while ago, with a lot of partners, we developed a checklist that asks, or that examines readiness. And that can include everything from infrastructure and computers and cell phones being available, but also kind of to the possibility to ID people, for example. Can we even identify people, and can we make sure that we can unambiguously identify them? And do you have the skilled personnel and financing, and actually continued financing for that? And I think the third question you need to ask yourself is whether you're willing to embark on a very long and complex project that will probably take you more money, more time, more resources, more energy than you thought it would take, because these are actually quite complex things, and you need to be in it for the long haul. So this is not a project, as I think Marta told before. It's really kind of like, it's a commitment, and the commitment is for a lot of time, and you might get a few extra gray hairs doing that. So these are the main questions you have to ask yourself before you even start with a registry. And then to the other question, is it then still worth doing? I think it can be, because I think the beauty of a registry is when you have this moment when it actually helps the nurses and the health staff more than it burdens them. So there's actually more things coming out of the registry than investment by the nurses going into it. And then you have this beautiful spot where it becomes really a well-oiled machinery, and it makes sure that indeed, like, no children are missed, they don't drop out. We have the right vaccines for them at the right place when they come. We can even send them reminders. We can do to-do or overdue lists, or we can start contacting parents of why they didn't come back and why they seem to be refusing such and such vaccine. So there's a lot of kind of potential juice that can be squeezed from a registry, but it's not. It's a big effort. So we need to consider that well before we do it. I don't know, Carolina, if you want to add to that.
Thank you, Jan, and hello, everyone. A few things to add and reinforce that really, if you're in for the long run, so really, I remember the first meeting we had in 2011 in PAHO about registries. We all thought that this was going to be a development that most countries will have in a few years, but not really. So we're almost 10 years later, and it takes a long time to develop an immunization registry, because you have to think about not only probably the easiest is the tool, but you also need to think about how complete it's your registry to have all the people. You have to think about the users, the health workers, and how they are going to be using this. You need to think about the sustainability, troubleshooting, how it fits with other systems in your country. Now, as per the benefits, last year there was two important literature reviews published, one from the PAHO team with PATH, the IDEA review, and one from the SAGE data working group. You can find them online. We'll probably put the links on the chat. But basically, registries can help because they automate or facilitate the automation of defaulter tracking and recall reminders. So that's the first benefit, if you would. The second, because you do have the production or the vaccination of each health facility, you can understand how the facilities are doing, if they are making mistakes, if they are capturing the children, you can understand the performance of the different providers. And the third one, if you are able to have it online, you can include some support to making decisions. So you can check in the registry, this child is due for X and Y vaccines, particularly when schedules are complicated or when the child is a little old, or the person it's a little old for the normal vaccines. The system can help you decide which vaccine this child is due. But otherwise, in a rural area where you have a particular file, well, you have books, that can work better. And I would not even recommend going to destroy something that works or can work really well in a rural community for something that may have problems of connectivity and incompleteness or difficulties. Thank you.
Thank you so much, Carolina and Jan, for those answers. We'll move on to the next question then, which is for Na, and that is, what was the main difficulty in implementing the Electronic Immunization Registry for you?
Hi, good evening, good morning, everyone. So on behalf of PATH Vietnam team, though I would like to share with you with some main difficulty implementing EIR. As some of you may know that implementation of EIR in Vietnam is really long journey for almost 10 years. And we started very small scale, 1 digit only. So now we're scaling up for 700 digits all over in our country since 2017. So during the implementation from the small scale to larger scale, we are having a lot of challenging and issue in different level and different time. So in summary, we got some challenging with different aspects. For example, for human resource, so it's very difficult for behavior change communication for health workers, especially the older workers, elderly. Closer retirement time, so they really hesitant to change from the paper to digital system from the beginning of implementation. And in Vietnam, we facing it frequent staff turnover. So we just have on staff, 1 or 2 staff in one commune health center, trained for EIR. And the next month when we come back, so totally is a new staff on board and know nothing about EIR. And also a lot of staff at the lowest level, commune level, they have very limited IT knowledge, even they don't know how to use computer. So for another aspect of system implementation that we have to keep in parallel system for many years for both paper and digital before going to entirely paperless system. So it really that causing the burden in some time, and also that was the health worker need to entry the back data entry for 2 years birth cohort. So it's really high burden for health worker at the beginning. And it's a system that at the beginning, when we develop, we do not anticipate the number of client register in the system. So it's big size of database and increase much over time when we do the nationwide implementation. So when query the big data, sometimes system experience problem. And in Vietnam, also another aspect that we having a lot of private sector who provide immunization service. So they really hesitant and they have low uptake to use the system. And even the government Ministry of Health reinforced many times for us but they still hesitant to do that because they have their own system for fee-based immunization service. So another aspect that I think that you hear very clearly during the presentation, that data use and data quality is very important, and this so another aspect of challenge. It happened in both paper-based and also digital system as well. So in terms of infrastructure and in some remote area, we have a very unstable internet connectivity and sometimes interruption of electricity, so it's causing a loss for the system implementation. And at the lower level, Ministry of Health, actually they don't have a budget, and a local level, they have limited budget for training, refreshing, or supportive supervision. And from the beginning, when we implement EIR, at that time, 10 years ago, almost no standard, no national standard, and very little global standard on interoperability, and also architecture, framework, policy guidance in place. And even some years ago, government, they didn't have a very clear roadmap, including costing plan, how much does it cost for system development, implementation, and scale up. And mostly they rely on the both technical support and financial support from international organizations like PAHO, or from private sector, from IT company like a Viettel, who now develop the system and maintain the system as a national scale. And another aspect that from local government and have leader at lower level, we have very commitment, and the commitment from the leader is very important to keep the sustainability of the system and also scalability of the system. So that's a very some key summary about the challenge we're facing for almost 10-year implementation. So I hope that's helpful for you, and happy to answer questions if any. Over. Thank you.
Thank you so much, Na, for sharing those experiences that you've had in Vietnam. We are going to go. Just wanted to note that it seems that Karen is having some connectivity issues, so that's why we have not been able to ask her the question. So we're going to move on then to our last questions, our last specific question from the panelists, and then we'll start trying to get to some of the questions. There's some great questions in the Q&A box, so thank you all for those. We're going to try and get to those after this. So the next questions for Fred and John: if you had to re-implement the Electronic Immunization Registry, what would you do differently? Over to you.
Thank you so much for that question. Yeah, so for Zambia, we have deployed the EIR in one province, southern province, in about 13 districts. And an additional province, which is Western Province, we are in one district. So if we were to re-implement the EIR, what would we do differently? Firstly, I would start with the system, defining the system requirements. We need to devote more time to the system development and testing until we are sure that now we need to deploy the system to the rest of the province or the country. What we've learned so far is that as we deployed the system, there are some other requirements that came to light which needed to be included onto the system development. Therefore, the lesson is that collecting the appropriate data elements for service delivery and reporting are critical to ensure that you have the complete system that is deployed to the rest of the country as it were. So doing it differently, we need, as we do the defining of requirements, to include the high level and also the lower level stakeholders to ensure a balance of understanding, which creates a more robust list of recommendations. So once we have this in place, we don't have the back and forth issues. Also, we need to take more time to observe the service delivery in the field to better understand the workflows of the systems and how the business is done, and address other challenges that the staff might be experiencing as they adopt the new system. Dr. Ruiz had alluded to the fact of, to the user-centered designs. Yes, it's important actually to involve the users. In Zambia, we had the user advisory group. These help to refine the interventions that were being deployed, and also looking at the ownership and acceptance of the new product that we had. So it increased their understanding because they were consulted, and this also helps not to waste much resources on the interventions that might not work or might fail. So how could we do it differently if we had to redeploy the system? Apart from engaging the users in one particular district, increase their understanding because so we need to engage the users at all levels of care to gain the feedback for system development, as well as to ensure ownership and sustainability for the interventions. And lastly, let me just talk about one challenge that we have or we've observed. This is on the parallel reporting systems. Yes, when introducing the new system or data collecting tools, in our case, the tablets, we had the rigorous paper tools that were being used. So this has taken quite long for the decision to be made to adopt one of the two systems. But this has actually affected usage of the newly introduced system, in the sense that the expectations were not put forth in the outset. So it is the lesson that we've learned is that we needed to put across what expectation the end users were looking forward to, so that at the end of the day, they do not, we do not suffer the infrequent use and compromising the data quality, as it has been observed that there's less usage of the system that has been newly introduced. And if we check in the LIGAS tools, the registers, we've also seen some gaps. This can be attributed to the fatigue that the end users might be experiencing. So the lessons there, or what we'd recommend or what we'll do differently if we are to redeploy, is to set clear expectations and guidelines. Also gain agreement at the ministry level to implement and communicate to health workers as appropriate when and how long they are going to use the dual systems. We needed to come up with a clear roadmap on how the two systems can work in parallel before dropping one for the other. So what is really cardinal is the issue of communication. If the communication is set out, is made clear to the end users, this will not affect the smooth transition from one system to the other. Basically, this is what I thought I should share with you.
Thank you so much, Fred, for sharing those. Maybe what we could call lessons from the future, or looking back what people who could be doing, taking into consideration as they move forward. We have some great questions in the chat box, and we will not be able to get to all of them, unfortunately, but we will try and make our way through some of them. The first question I would like to direct to the team in Geneva, to Carolina and Jan, which is EIR have many advantages, but how can it help address the important issue of data accuracy for immunizations?
I can start. So the data accuracy, the data is going to be as accurate as the data is entered, right? So it's important that the vaccine that was given, that the person that was vaccinated, that information it's true. So first you need to identify the person, and you need to make sure that you go beyond the name, because names are repeated. So the issue of unique identifiers becomes really important, and then of looking for potential duplicates of people and deduplicating them. So that's a whole aspect about the child or the person being vaccinated, and that quality. Then you have the quality of the information of the vaccines being given. You have to make sure that if you gave a pentavalent vaccine, that you check the correct box and you don't check accidentally meningococcal or something else. And then, of course, it's important. And in some developed countries, there are barcodes, but we are not there in most places. So it's really, you have to be very careful with how you enter the actual data. And then if you want to use the registry to calculate coverage, you also have to make sure that it's complete, or at least use a different denominator to understand how complete this is likely to be. And there are assessments of data quality for data in a registry, just like there are data quality assessments for aggregated data. So the data is only as accurate as the data that is entered, and there are ways to try and check. Jan?
Yeah, I just want to add maybe one thing. I think if I think about data accuracy, there's always two parts of that, right? So there's the denominator and the numerator. So if you start with denominator, because that's often the big problem that we have, I think that I think often kind of registries are kind of shown or are kind of like promoted as an example of how we can solve the denominator problem. And I think we have to be very careful about that, because I think there can be ways that the registry can certainly help. And for example, finding out better like what the real populations are in different parts of a big city, for example, or these denominator inconsistencies between district registries, deal better with them, because you can look at people not just by their place of residence, but also like where they come for vaccination. So, and that allows you for a lot more kind of insights in denominator. So I think that's interesting. The other part that's also interesting is with the numerator itself. So yes, the data is as good as it's entered, but with the registry, you actually have much more control about the numerator as well, because over-reporting isn't that easy anymore, because like any over-reporting would have to be on real records of real people, and it's not that easy to kind of over-report that way. There's probably also kind of more ways to kind of avoid double counting, or for example, control that people who are reported as a DTP3, for example, or a Penta3, really received Penta 1 and 2 as well. So there's more control of that, but it's not a silver bullet solution, but there's definitely things you can do. And I think that there's actually advantages both for the numerator and the denominator, but what I want to caution for, like if you want to use it for coverage monitoring and coverage reporting, then indeed your denominator needs to be very complete. So the registration, the completeness of registration needs to be very good. Over.
Thank you so much, Carolina and Jan. We are going to move to the next question, and recognizing that we have about 10 minutes left of the session, we wanted to ask for these questions if the responses could be around 3 minutes or so. The next question I have is for Fred, and this is a very just a practical question. When you're working with EIR, do you need internet connection every time, or can you enter information offline and then upload it online later? So go ahead, Fred.
Yeah, so that's one of the considerations that is supposed to be put in place when we are doing the system requirements. Like in our setup, not all the locations have access to internet. So the EIR has the provision to work in an offline mode. The facility staff could enter and update all the data in the offline mode. And at a later time, when they come into contact with the internet, that's when they can synchronize the data to the server. So we have almost about half of the facilities that are working in offline functionality.
Great, thank you so much for that answer. Na, a question for you. from coming from the chat box, we have challenges on data discrepancies between data tools that should tally. How can EIR be useful for that?
So I think that yes. So is when we have a parallel system, so we can see discrepancy from the tally sheet and it's the data from EIR. But actually, during the implementation, there are several different ways health workers think about how to address that. Some health workers, they first, in some facility, they first record into the paper-based tally sheet, and then later they enter the data into the system. Some other health facility, they just enter directly to the system. And they going back, it's a little bit funny, but they going back to update the immunization ledger or any paper-based system. And some health facility, they just completely ignore the paper-based system. They just work with the EIR. So different thing. But the most important thing that through the supportive supervision, we need to conduct the monitoring activity to ensure the data quality at each level of health facility. Over.
Thank you so much, Na. A question for Marta. We know that healthcare workers are absolutely key for this. How do they accept these systems?
Thank you very much for this question, Lauren. And I think that they are the key of the system. I think that's important to involve them since the beginning of the development of the system. Otherwise, to try to them to accept the system could be difficult. So at the beginning, when you are starting to think in how to implement a system, you have to create a group for work. As I mentioned, this is not a work of one. So in this group, you have to involve people in the field who has to fill the data right now in a computer. I don't know how it's in your countries, but in many of our countries, the nurses, they don't have a good relationship with computers. So we have to start since the beginning, for them to understand what is the system and how the system will help them to develop their job. So I think they are the key issue in the system, and we have to think on them always when we are trying to develop our system. The system should help them to develop better their job. It's not a new pain. It's not another pain. It's not another thing that they have to do. It's a tool that helps them to develop better their work. So thank you for this question, because I think they are the key elements, and we have to have them in our minds always since the beginning to develop the system. Thank you.
Thank you, Marta. That's great advice. A question for Jan, I think, and that is if EIR can also include a cold chain inventory system.
I think that Marta, in one of the first slides, kind of showed all the bubbles and the different things that EIRs can do, and I think they often actually have like a link to supply chain, so to the stock management. Because ideally, if you think about it, the closed loop in immunization would be that you follow up on your stock and your vaccines, and then you make the link when it gets to a child. I think one of the vision that a few people have or could have is that at one point you scan a barcode on a vaccine vial and you scan a barcode on an immunization card, and then you link the two, and now this is kind of all a closed loop system, and we have all the information that is needed. So yes, it can be part. The cold chain as such, if you think about cold chain systems in terms of how much capacity we have and how much stock is available, yes, it can be, but it's not always the case. So I would say there are systems that do everything, and there's also systems that focus more on the vaccination record itself. But I think at the very least they include the vaccine product and lot. I think they should. And then sometimes this can be linked into an LMIS system or something like that, or sometimes the LMIS is part of the electronic registry. So yes, it can, but it's not always the case.
Okay, thank you. Thank you for that. Fred, a question regarding immunization of a child and is from another part of the country. With the EIR, how can it be integrated to track a child's immunization, or if a child has been immunized in your facility and then goes to another part of the country? Is there a way to follow that child's immunization schedule and kind of keep track and everything and keep everything integrated?
Thanks. That's a very good question. Actually, we have the provision for children from outside the catchment area. So if the child comes from outside the catchment area where the system has been deployed, it's very possible to track that child and to update the services that have been provided. Now, the challenge that we have at the moment is that the system is just deployed in about 14 districts across 2 provinces, and we don't have the system in the other part of the country. So if the system was deployed everywhere, it's very possible to know which children are coming from your catchment area, as well as those that are coming from outside the catchment area, and the services are updated in the system as it were.
Thank you so much. And I think we're going to try and sneak one more question in. And Carolina, if you could just talk for a quick minute about how long it should take countries to develop EIR, and maybe also a quick mention of how different regions have financed them. If you could talk to that real quick. Thanks.
Thank you. So the financing and the sustainability and how long it takes, it varies a lot. And it really depends on the context, as in big parts. So first of all, if you have a digital health strategy, if you have infrastructure, if you already have other systems, it can be probably cheaper and it's not the first thing you're doing. But because most countries are not there yet, I would say some countries have taken 10 years or so to have something functioning. Some other countries like Chile, for example, they started during the influenza pandemic to track influenza, and it was implemented rather quickly. In a couple of years, they had a functioning system that then they built in, and then they had to replace the tool even. So just another thing, there are some questions there, whether it's DHIS2, whether it's some other tool. WHO does not provide an immunization registry tool. The country normally has to follow their procedures to decide which tool, which software is going to be used, and then how it's going to be financed. Gavi, I know that Gavi is trying to gather the evidence and starting to support some countries, but again, I think the most important message is that this is not an easy solution. If you don't even have the problem, or you have not even checked if you have the problem, really think about readiness first. Is your country and your setting ready in terms of infrastructure, in terms of buy-in from the government? Is there a digital health strategy? In the Americas, when I was working there, we saw some countries that had developed beautiful systems, and then change happened, and then the system was abandoned and lost. So it's also not something that you just do once and forget about it. You do have to keep investing. It's like when you buy a car, right? You decided that you're going to be a driver and you're going to have a car. So you first need to research if you have the money to afford the car, if you know how to drive the car, if you have the insurance for the car, etc. Then you become the driver. Then you can change the car if you need to. But all those things need to be in place first. If you buy a car and you don't know how to drive, not such a great thing. If you buy a Ferrari and then you don't have roads to ride that Ferrari in, you may have been better with a buggy or with a little Jeep or something else. So really, probably the key message here is it takes a long time. It needs to be a constant investment in troubleshooting, maintaining, etc. And then, so governments need to be making the investment to maintain it. So the seed money for the tool may be provided by support of other organizations, but if it's really a tool of EPI or of the Ministry of Health, and therefore it needs investment and time to have it running and keep it running. Thanks.
Thank you so much, Carolina. And it is now 9:01 in DC, so that means our webinar has ended. I want to thank you all again, everyone who is connected here on the Zoom, all our friends who are following on Facebook. Thank you so much for joining us. A big thank you to all of our panelists today who lent their expertise to share. There's obviously a lot of great interest in this topic. So thank you all for your questions, and thank you panelists for your time and your support. And also a big thank you also to Reda and his team, because this was a great webinar, and we really appreciate the platform and the space that you've given to this important topic. So if you are looking for more information, I can say from the PAHO, I think the link was shared in the chat, but it's also available on the website. There's a great EIR guide on planning, development, and implementation that you might want to check out. And I will now give the floor back to Reda. Thank you all again so much.
Great, thank you so much, Lauren, and to the great panel today. I'm showing on screen the main resource that will be used in the course, but it is available from the PAHO website. We'll be sharing the link and actually probably the PDF with everyone who is registered for this session. You heard a faint round of applause, but I suggest we end with a round of applause, which is probably what would happen with almost 500 people in the room right now, and almost 1,000 who've participated today. So thank you, and look forward for those of you who will be accepted into the course. You'll be deep diving into this. For those of you who are interested, please let us know. Stay in touch so we can continue to offer something on this topic, important topic.